So over the last few years, primary care has changed significantly. We're working much more closely with our colleagues in primary care and liaising with services such as your local pharmacy, opticians, dentists. Within practice, we have a number of other specialities now, including physiotherapists, advanced nurse practitioners, to try and provide a holistic approach to patients' health and well-being. Also in GP surgeries now, all our receptionists are being trained to become what we call care navigators, because they've been trained to direct you to the most appropriate healthcare professional, and that may not always be going to see the GP. The idea of working as a multidisciplinary team is that people can access the right care at the right time. GPs will still see and can still deal with a lot of the conditions that other professionals can deal with, but because the individuals are trained in that specific area, if it's a medication problem, seeing the pharmacist who has much more knowledge about medications and interactions would provide a better service than perhaps going to a GP.